Hello friends, so we are back with the new topic and our today's topic is thumb sucking. Thumb sucking is placement of thumb in varying depth into the mouth. Coming to the classification, thumb sucking can be normal and abnormal. According to American Association of Orthodontics, up to 4 years thumb sucking is normal, whereas beyond preschool period it is abnormal. Abnormal can be psychological and habitual. Psychological is having deep rooted emotional factor, where habitual is because of the addictive habit. Then it can be nutritive and non-nutritive. Nutritive, which will provide nutrition like pacifier and all, and non-nutritive like thumb sucking, which does not provide nutrition to the body. Now coming to the subtolerating classification given in 1973, he categorized the thumb sucking into 4 categories. Type A, B, C, D. Type A is 50% of the children, which involves placement of thumb into the oral cavity where the thumb is placed on the palate beyond the first joint. Then type V, which includes 13 to 24% of the patient and where the thumb is placed inside the oral cavity but not on the palate. Then Type C, it is 18% of the population where the thumb is placed beyond first joint and there is no contact with the mandibular incisor. Then type D, which includes 6% where there is little or no contact with the incisor. Now coming to the various theories of thumb sucking. First is Freudian theory given in 1905, who told that there is various phases of psychological development in which the oral phase is very important because in oral phase the mouth is the erogenous zone. So any kind of deprivation of activity will leads to the emotional insecurity and child will start the thumb sucking. Then coming to the oral drive theory given by Sears and Weiss in 1982, they explained the prolonged nursing reason that the strength of oral drive is in a part of a function. Then coming to the rooting reflex given by Benjamin in 1962, rooting reflex is very common in first 3 months of the life. It is nothing but the placement of infant head towards the object which is touching the cheek. Then coming to the sucking reflex given by Erugel in 1962. Sucking reflex is very common in 29th week of intrauterine life, started intrauterine and continue throughout the life. Then coming to the learning theory given by Davidson in 1967, he explained the non-nutritive sucking which stems from an adaptive response. Now coming to the various etiology of thumb sucking, there are various factors involved in thumb sucking. First is socio-economic status. Those parents or those family which has a high socio-economic status, they will have a proper time, they will give their children proper feed and proper nutrition. But in case of low socio-economic status, the child will be deprived from the nutrition and time and will start the thumb sucking. And then second is the working mother. In case of working mother, the child will develop the feeling of insecurity and will start this habit. Whereas in case the mother who is working at home or who is with the child will give the proper love and affection to the child. Now number of sibling. If there is more sibling, there will be more attention to the younger child and the elder child will start thumb sucking. Then the order of the birth and then the social adjustment. Coming to the diagnosis of thumb sucking, first we will take the history of the patient. We will take the history like frequency of thumb sucking, in which intensity he thumb sucks and duration of the thumb sucking. Then second is the emotional status, whether the habit is meaningful or the empty. Then we will see the extraoral examination. In extraoral examination, we will see the 3 things. First is nail, then lips, and then profile. Nails, the nails will be short, chapped, and there will be dish pen appearance of the thumb. Then in case of lip, the upper lip will be short and hypotonic, whereas the lower lip will be hyperactivity due to activity of mentalis. Then the profile, because of the protrusion of incisor, the profile will be convex and there will be protrusion of the incisor. In intraoral examination, we will see the open bite which is anteriorly placed, anterior open bite, then proclination of the upper incisor, and because of the placement of thumb, there will be deep palate. Now coming to the various dentofacial changes occur after thumb sucking. First, the effect on maxilla. There will be increased arch length of the maxilla. There will be high arch, atypical resorption in anterior teeth. There will be increased trauma to the upper incisors. Then the interarch relationship, there will be retrusion of mandible and retrusion of mandibular incisor. There will be increase overjet, decrease overbite. There will be posterior crossbite and anterior open bite. Then coming to the effect on lip, there will be tongue thrusting, and because of this there will be hypertonic upper lip and there will be hyperactive lower lip. These all are the dentofacial changes after thumb sucking. In next video we will discuss about the management of the thumb sucking, how we will treat the thumb sucking patient